Good morning, CCHF. It's been a long time since I've seen all these faces, and I just want to say that it is amazing. The last few days have been absolutely amazing, meeting students, meeting all of you guys. But today I do have a purpose, and before I ramble on like I tend to do, I'm going to get right to it. So I have the honor and the pleasure today of introducing someone that is very dear to me, personally, professionally, spiritually, emotionally. And I thought about the best way to introduce Dr. Glick was by telling the story of Judah. So I'm not talking about Judah in the Bible, y'all. I'm talking about Judah Leonard, who is my little guy, my son at home. I'm going to make this connection real quick. My name is Takesha Leonard. I am the medical director and a family nurse practitioner at Jericho Road in Buffalo, New York on our east side. Judah was born in July of 2013. It was right around when I first started at Jericho Road. I was just trying to learn the ropes about, what I was becoming as a nurse practitioner and, kind of who I was evolving into. And there was an insurance company that invited us to a breakfast. And they sent a letter out to all of the providers at Jericho Road, and I was about 7, or I might have been 8 months pregnant with Judah at that time, and the letter said that it was free breakfast, and at the end of this session, you would get a $250 gift card. So, I was in. That was it for me. I had 4 of the boys at home, just so y'all know, so $250 and breakfast was great. So there was about 60 seats. I got there early, y'all, because, I was thinking they were serving the Danishes that I like. I wanted to be nice and early so I can make sure I was sitting well and everything was good. And so there was about 60 seats, and maybe 40 of them were open. And so I sat down, and in comes Dr. Glick, and I'm thinking, there's 40 seats here that are open, and this one is right next to me, so I'm sure he's probably going to choose one of these other, 39 seats and not this 40th one. Dr. Glick chose that seat right next to me. So during the presentation, there was a physician that was ahead of us that was telling us about these new insurance changes that were going to impact the lives of Black and brown communities, that they were getting rid of all these services, and basically what we were there to do was try to encourage our patients to kind of be okay with this new change in their insurance plan. So this is my first time at one of these meetings. I'm just sitting there eating, thinking about my $250 at the end, and I can see Dr. Glick kind of shifting in the seat a little bit. So, I look over, you all right? So he says to me, Takesha, this is ridiculous. And so I'm thinking, if you're trying to whisper, that's not a whisper. So now I feel Judah do something real strange inside because I am definitely responding to what's going on over there. So he is almost in a full-blown dance now because he is clearly upset. And so I was intently listening to what this doctor in charge of this insurance company was saying and how he was cutting all these services. And let me tell y'all what happened next, y'all. Now the seats are all full, 60 seats in there. White, Black, brown, Hispanic, Latino, all physicians, medical directors. Dr. Glick stood up. He stood up. And Judah did a full somersault inside of that belly. Judah, I have never seen anything like this. And what he did is he stood up, and he didn't stand up and was quiet, or he said, "Why would you bring me here? Why would you bring me here to tell me to take that back to the communities that I take care of?" Then he said, he called that man by his first name. "You know me. Why would you bring me here?" I was shocked. I'd never seen anything like that. So the gentleman up front tried to call Myron by his first name. Myron, he tried to, but Myron, please, Myron. No, Myron was gone. We weren't reeling Myron back in. But what I noticed in that moment is everybody started standing up now. Everybody, yeah, they all with Myron now, but Myron was first. He was first. right? He shut the whole thing down. They couldn't even continue the rest of the conference because everyone was now, no, we're not doing it, we're not doing it. And so I started to gather up the rest of my Danish because I'm trying to get out of there, and Judah is having some trouble now. Judah is not happy about this whole situation, so I'm going out. And what I was trying to do, y'all, and I didn't tell Myron this, but I was trying to not be with Myron. I was trying to get out of the city. And it was raining outside. Dr. Glick, I don't even know if you remember this. I was gone, and here he comes. Takesha! He's following me out of that room, y'all. And now we're outside, and it's raining, so I just mentioned to him, Dr. Glick, it's raining. Y'all ain't gonna believe this, y'all. He opened an umbrella and put it over me. And he said, Takesha, when I am gone, I expect you to stand up. It is our job not to sit there and let our communities of color be disadvantaged. You stand up. You stand up. Right? Needless to say, Judah came about 3 weeks later, a little bit early. But I've been standing up ever since, y'all, and it is my honor, my pleasure to introduce Dr. Myron Glick, CEO and founder of Jericho Road Community Health Center.
Thank you. You keep that. Thank you, Takesha, for that kind introduction. You know, I was nervous about this morning. I mean, first of all, you guys are a big crowd. I'm not used to this. I'm a family doctor. And secondly, Steve called me and I'm supposed to stand in for Brian Stevenson. But when I saw Eva bravely walk all by herself all the way up to this platform, I figured if she can do it, then I guess I'm going to be able to do it too. So I do want to thank Steve this morning for this opportunity. I want to thank Steve for his wonderful leadership and stewardship of this organization for more than 12 years. And I'm really grateful that he is still with us. And Joyce and I are 4 children, and the many, many staff at Jericho Road that have worked these last 25 years with us, and some of them are here today. We can testify that God has been faithful, that God has provided, that God has been merciful and shown us much grace. And, today isn't about that, but I just want to take that time to say that whatever God's accomplished through us at Jericho Road, it really does reflect God's provision and faithfulness. I wish in some ways that I could speak about that today, but what I'm talking about today is something that's going to be a little tougher. It's going to be hard. I'm not even sure I'm the right person to speak it, but it's what God has put on my heart, and I haven't been able to shake it. And so today, I'm going to talk about why do black folks die young in America, racial health equity, and what it means to love our neighbors and to be true followers of Jesus. And as I begin, I want to tell you about Nehemiah. Nehemiah was a child in Jerusalem, and in a moment of time when he was a kid, Jerusalem was invaded and defeated by the Babylonian army. And Nehemiah, along with many of his Jewish family, friends, neighbors, were taken in captivity to Babylon. And Nehemiah grew up in Babylon, and he started to do pretty well. In fact, he became the cupbearer for the king of Babylon. And my guess is, it doesn't say this in the scripture, but my guess is he was doing pretty good. He had maybe sort of put aside the suffering of his past and of his people and was focused on doing what he could do to make a life for himself. He was living his life. But one day, someone came and spoke at a place where Nehemiah was at. This person had just returned from Jerusalem, and this person described what was happening in Jerusalem, that the walls had been broken down and destroyed, that the walls signified that which was good, signified that which protected, that which kept people safe, that had been destroyed. The poor in Jerusalem were being oppressed to the point that sometimes they had to sell their kids to pay back debt. And they had lost their way and their promise with God. And in that moment, I mean, Nehemiah may have heard it before, but in that moment, Nehemiah realized, maybe for the first time, he felt the awful stuff that had happened to his people. And the scripture says that he tore off his clothes, he put on sackcloth, and he laid in ashes for 3 full days, praying before God. And in that moment, his life was completely changed. What he had done before no longer mattered. He went to the king of Babylon and said, I need to go home. And I'll get back to this story in a little bit. But I have felt like Nehemiah at times in my life. I grew up, first of all, my parents were Amish, Mennonite, born in Lancaster, Pennsylvania, in a close-knit Amish community. When I was 3, my parents moved to Central America, to a country called Belize, and I lived there till I was 14. Moved back to Lancaster and eventually to rural upstate New York. And in that time, I knew a little bit about what it meant to not have health insurance, because Amish folks don't have health insurance, but I did not know, did not feel the way the poor were treated in this country, and especially the way black folks and people of color were treated. I didn't feel it. I didn't see it. I didn't know it. And when I got into medical school, and in my 3rd and 4th year, I was doing rotations in the public county hospital and other hospitals across Buffalo. And I feel like that was my Nehemiah moment. I suddenly realized that the poor and people of color are treated horribly by our healthcare system. And I was like, I didn't sign up for this. This is not what I thought I was going to see and feel and experience as a doctor. I thought I was going to be a doctor and go back to Belize or some other country and be a medical missionary. And instead, in that moment, I was faced with this realization that God was changing the call in my life. And so, did family medicine residency training, and Joyce and I went back to Buffalo and partnered with a Mennonite church and started Jericho Road as a solo family practice 25 years ago. And God has been faithful, and we've grown so much. Then in 2005, in August of 2005, a powerful hurricane hit New Orleans called Katrina. And people in New Orleans who were in the lower levels of the city, the levees were breached, and the full flood force and the wind and everything came in, and much of New Orleans was underwater. And I remember being in Buffalo as a family doctor, looking in horror at the TV and wondering, why is it mostly black folks that are on the rooftops who are not getting rescued? And why is it mostly black folks that are filling up the Louisiana Superdome? And why is, when everything was finished, that you realize that disproportionately people of color died and suffered during that hurricane? And why was it that the hospitals that were flooded were mostly the public hospitals in New Orleans? And then fast forward to the COVID pandemic. As pretty much as soon as back in March of 2020, when we realized that COVID was coming, and we didn't know what to expect, but we knew it wasn't going to be good. And we figured that it was going to hit the communities that Jericho Road serves especially hard. In that moment, we decided to open up isolation units in 2 different parts of our community. And we decided to do something different. We said, whoever you are, no barriers. You don't have to have insurance. You don't have to have a doctor's appointment. You don't have to call us first. You can just walk in. You don't have to be our patient. But you can come in. You can get tested. You can get treated if you're sick. We'll hospitalize you. And eventually we'll give you a vaccine. And we, over the course of the last 2 years, have tested over 40,000 people. We've given more than 30,000 vaccines. We've hospitalized hundreds of people to our inpatient family medicine Jericho Road service, and we've seen more than 20 of our patients die. And we've kept really good data. And let me tell you that our data clearly and unequivocally shows, without any doubt, that in Buffalo, like across our whole country, that black folks were much more likely to get COVID, to test positive for COVID, to get sick with COVID, to be hospitalized with COVID, and to die from COVID. The CCHF movement, our movement, was born in part out of the racial health inequity that John Perkins and others witnessed in rural Mississippi in the 1960s and 70s. Today, in places like Buffalo, Chicago, Memphis, Pittsburgh, Philadelphia, Los Angeles, Atlanta, we work in communities that are broken, that are beat up. As followers of Jesus, we must recognize that much of this brokenness is rooted in the 400-year history of racial inequality in this country. Today, I want to talk honestly about what I have witnessed as a family doctor at Jericho Road and what we can do about racial health disparities. I mean, the bottom line, the inequity, is that black folks die younger than white folks in this country. Black folks live, on average, 5 years less than white folks. Black folks are more likely to die from stroke, breast cancer, cervical cancer, heart disease, diabetes, COVID, HIV, AIDS, to die during childbirth, and to have their babies die in the first year of life. So why is this? I feel like we have to honestly understand and look. We can't hide from the truth. It's before us, but so much of the time we are called to do the work that we do, and I think sometimes we forget about the root causes of why there is the brokenness in the communities that we serve. And if we don't recognize it, we can't fix it. We can't be part of the solution. First, I need to be clear about what it is not. It is not a genetic difference. Takesha and I have the same genetic DNA. You can't tell us apart from our chromosomes other than, I'm a guy and she's a girl, right? It's not due to individual behaviors. Obviously, individual behaviors make a difference in individual lives, but the behaviors do not make the difference in the inequity. And it's not due to a faith or religion gap between black folks and white folks. The real reason is that there are structural things that have been put into our system that hold black people back. And these structural things, these rules, these regulations, these attitudes, these systems are still alive and well today in our country. And that's what I want to talk about today. This structural racism is the reason why racial health inequity exists. It's the reason why more black folks have died during COVID than white folks. To understand this problem, we need to talk about the social determinants of health. These are the conditions in which people are born, grow, live, work, and die. Things like educational status, income levels, employment, race, zip code, family and social support, air and water quality, exposure to the criminal justice system, etc., etc. One of the sobering realities that the experts tell us is that the health care that I provide as a doctor is only about 10% of what it takes to keep someone actually healthy. And that genetics, our genetic code, maybe is another 10%. But 80% of what keeps us healthy as individuals, as families, as communities, has to do with the social determinants of health. I give you an example. I have delivered lots and lots of babies. I mean, last week I delivered 11 babies as part of helping our residents in our family medicine service. And honestly, the babies all look the same to me for the most part. They're all crying. They all weigh somewhere between 4 and 10 pounds. Hopefully not 11 pounds. And at that point, you would think that they would have the same amount of potential, the same amount of promise. But the reality then, as a family doc, is I see these babies grow up at Jericho Road, and they don't end up the same. And the reason they don't end up the same is because of what we're going to talk about next. It is my belief that the racial health disparities that I witness daily at Jericho Road can be primarily explained by understanding 3 social determinants of health that especially affect African Americans: racism, poverty, and residential segregation by zip code. There was a young woman named Cynthia Wiggins who died in 1996, just as Joyce and I were getting ready to open Jericho Road. And I think her story illustrates a little bit of the point. Her family were our neighbors on the west side of Buffalo, but Cynthia was 18 years old, a black woman, single mom, and she lived on the east side of Buffalo, which is where most black folks live in Buffalo. And she had a job, and the job was about 30 minutes away at an upscale suburban mall. And she would take the city bus number 6 from her home on the east side to that mall. Unfortunately, they would drop her off outside the mall premises, and she would every day have to cross a busy 7-lane intersection to get to her job and then walk another half mile to get to the store that she worked in. One December day, it was snowing a lot. It does snow in Buffalo. And there was these big, snowbanks, and as she was stepping out onto that busy highway, a dump truck turned, didn't see her, and killed her instantly. And her family, at first, it was viewed as a tragedy by the newspapers, right? But her family understood why she actually died. And they hired this attorney who was famous at the time because he was O.J. Simpson's attorney, Mr. Johnny Cochrane. And he came to Buffalo, which is a big deal. Actually came with his, SUV on our block. And what Mr. Cochrane found out is that for the last 8 years, the Buffalo City Bus Organization had been begging the mall to let their bus go drop people off at the front door. Because every bus from Canada was allowed to go to the front door. Every bus from the non-white parts of Buffalo and from the suburbs was allowed to drop their passengers off at the front door, but not bus number 6. And as they were doing the deposition for the trial, he got the owners of the mall to say that, to admit that they had not let the bus 6 do that. They said, quote, they wanted to keep inner city crime out of the mall. Needless to say, they had to pay a lot of money to this family, and the law was changed. But it did not save Cynthia Wiggins. She died because she was poor, she died because she was black, and she died because she lived in a part of town that was discriminated against. I've often wondered about why Medicaid was founded. We see a lot of Medicaid patients at Jericho Road, as many of you do also. And I remember when we started in 1997 as a private practice doctor, Medicaid paid us $11 a visit. My first Medicaid check was for 50 cents. And so there was a big incentive for young private practice doctors like me to not take Medicaid. But of course, that wasn't our mission. Our mission was to take whoever needed care, regardless of their insurance status. So why was Medicaid formed, and when was it formed? And it turns out that if you look back, there was this real push in the 50s and 60s across our country to look at the poor black folks in the South and the North who didn't have access to health care. People couldn't afford health care, and there was this big push, one of the first pushes, to have a single-payer national health care plan. And there was a lot of momentum for that. And then in 1964, the Civil Rights Act was signed by Lyndon Johnson, and the Voting Rights Act. And they were getting ready to have this national health care plan that would take care of the elderly, the poor, in one plan. But this provision in Congress faced fierce opposition from Southern segregationist senators and congressmen. because they knew that they would no longer be able to segregate their offices and keep black folks out. And so in 1965, a tragic compromise was formed. They formed Medicaid, which would be the health care for the poor. It would be disproportionately serve people of color. It would be managed by states, individual states. So New York State could say who qualified and what kind of services, and Alabama or Georgia could make it a different way. Hospitals could opt out, doctors could opt out, and the fee schedule would be minimal. And for the elderly, who were mostly white, they designed Medicare, 80% white. Federal government managed, not states, so that regardless where you lived in the United States, you got the same care. And all hospitals would accept it, and it would set the standard for reimbursement in the future. And so you take that structural compromise that was done because of racism, and I can draw a direct line from that to why black folks died in New York City during COVID. So in New York City, you have public hospitals like Elmhurst Hospital, and these public hospitals mostly serve uninsured people with Medicaid, black and brown folks. And you have private hospitals, some of which maybe you as medical students actually attend. NYU, Mount Sinai, Cornell, Montefiore, Northwest. And they mostly serve wealthy, white, privately insured folks. And during COVID, the New York Times had a great study on this, where they put reporters in both hospital systems, and they watched what played out, as in March, April, May, over 20,000 people died in New York City. COVID hit New York City incredibly hard, and so many people suffered. They found that in the public hospitals, ER nurses were sometimes one nurse was seeing 23 patients. And in the private hospitals, one nurse was seeing 4 to 6 patients. They found out in the ICU that one nurse was often taking care of 8 patients who were ventilated at the same time, whereas in the private hospitals, they were taking care of 3 patients. They found out that many people on the public side didn't have access. The kidney dialysis units were overwhelmed. The ECMO machines were not available. They didn't have remdesivir, and they didn't have exposure to under clinical trials. They had old ventilators. They found out that on the private side, they had access for anyone who needed it, and it had state-of-the-art equipment. In fact, it's been reported that there were doctors on the private side that were begging the mayor, begging the governor to take the overwhelmed ERs on the public side and bring these folks over to the private hospitals to try to help manage the crises. And administrators and other people, including the governor, refused to do that. In all of that crises, there only 50 patients were transferred from ERs to these hospitals that had everything they needed and were not even that busy. And so black folks were 3 times more likely to die if they went to a public hospital during that crisis. The reality is that black folks have access to less quality care for a number of reasons, partly just because they're more likely to be uninsured or to have Medicaid. There was a survey in 2015 of all the family doctors across the United States. And in that survey, 45% said they'd be willing to accept new Medicaid patients. And those same people said 94% of them would be willing to take new private insured patients. The CEO of Mayo Clinic, basically it was a hot mic moment for him in 2017, but it's reported that he said, and I quote, "Mayo Clinic prioritizes the care of privately insured patients over those on Medicaid." Black folks are more likely to live in areas that have few health centers. This long-standing residential segregation means that they have less access to hospitals and doctors' offices. The medical training of students and residents disproportionately relies on the use of poor communities of color. And so you wonder about the actual quality. You know, there was two things. It was a number of years ago. I called a cardiologist who helps me with a lot of my patients. And I said, I have this guy, he's in his 60s. He has this typical chest pain. He's not having it right now. I don't think he needs to be admitted, but he needs a cath. He has lots of risk factors. And he was like, fine, let's do it. And then he paused and he said, Dr. Glick, what's his insurance status? He probably knew that, right? Because people know Jericho Road. And I said, he doesn't have insurance. And he caught himself, and then he literally said this. He said, Dr. Glick, you should send him to ECMC. My residents need someone to practice on. Paul Starr, in 1982, he wrote this book called The Social Transformation of American Medicine. In it, one of his main arguments is that American teaching hospitals have deliberately built their centers in areas of urban poverty so that students and residents would have access to poor patients to learn from. Black folks are often treated also by white doctors, by us. And we have biases, and sometimes we don't even know we have those biases. There was a study in the ER where they found that same diagnosis, same presentation, they used actors. And black folks who presented with pain were much, much less likely to receive pain medications than white folks who presented the same problem. There was a study of 220 white residents and students in 2016, and they had to answer a series of questions. And one of them came out that they thought that black people had thicker skin and could tolerate pain better. During COVID, this became more of an issue. This whole thing about why black folks don't trust us, right? And I'd have someone say, as I was trying to convince them that a COVID vaccine they don't trust. Someone even mentioned this study. You know, in 1932, the U.S. Public Health Service started this study called the Tuskegee Study of Untreated Syphilis in the Negro Male. It's where much of what we've learned about syphilis today comes from, because they recruited these poor men from Macon, Alabama, in 1932, when Jim Crow was very, very strong. There was no informed consent. They were never told they had syphilis. They never got treatment with penicillin, which would have cured them. They watched these poor black men basically die. They recruited them to die. And this is something that people overall still think about as they decide if they can trust us. One other major inequity that we see in our system that has systemic roots is this idea that in a country that has 13.4% of its population are black, that only 6% of our doctors and our medical students actually are African American. I believe that this gap is caused by structural racism. If you think about how the advantages that I as a white child had compared to a black child growing up in general. I mean, the median family income of a black family in this country today is $17,600. Black children are more likely to face hunger, to have high lead levels, to live in single-parent homes. They are more likely to attend substandard schools that do not offer AP classes and do not have college advisors. Keep in mind that the major source of local funding for public schools comes from property taxes. So housing inequality leads to educational inequality. Black kids are less likely to have connections to have an internship, to do a shadowing, to be mentored. You know, this whole MCAT thing, my feeling is the MCAT should go away. I believe that the MCAT does not measure aptitude, doesn't measure intelligence. It doesn't even measure potential. And there's been lots of studies that show that the MCAT, you know, it doesn't matter what you do on the MCAT. If you actually get to be a doctor, you're going to be fine. The MCAT instead measures opportunity. That's right. That's what it measures. I mean, I grew up as a pretty poor, I'm not black, so I'm side here, but I grew up as a really kind of poor Mennonite Amish kid. I went to schools that were like one-room schoolhouses. I never saw chemistry and all that stuff, no AP classes. Got to college finally and really struggled. I took my MCAT without any prior, studies. My parents couldn't afford to send me to some, pay $3,000 for a class, et cetera, et cetera. I took the MCAT. I did poorly, and I barely got into one medical school, Oral Roberts University, probably because they thought I would be a great missionary doctor someday. And look, once I got into it and understood what I needed to do, I was a fine medical student and could have done anything and ended up being at Jericho Road, and I'm a pretty good family doctor. The point is, the MCAT is a waste, and it's part of the structural, what structurally keeps black folks from excelling and getting into med school. The second structural social determinant of health that is a powerful reason for why there is racial health inequity is poverty. Poverty on its own is a powerful social determinant of health. The life expectancy gap between those of us in the 1% of wealth and the poorest 1% in the USA is 14.6 years. Being poor, scientists have shown that being poor is worse for your health than a lifetime of smoking. Poverty often forces people to do some of the following things: live in communities without access to healthy foods and good health care and green spaces, to live in substandard homes with increased lead, to live close to factories, highways, garbage dumps, to attend substandard schools, to ride 2 to 3 buses to get to work because they can't afford to buy a car, to live in high crime communities exposed to gun violence, and to struggle when exposed to the criminal justice system because they can't afford an attorney. They have to take whoever the court system gives, and they can't afford bail, and so sometimes they're sitting in prison incarcerated because they weren't even convicted of a crime. Being poor is very, very bad for your health. But here's the thing. Because of a 400-year history of slavery and racism, black folks are much, much more often poor than white folks. Black people today own only 3% of the wealth in the United States. The median family wealth of a white family in the United States today is $171,000 compared to $17,600 for black folks. In Buffalo, 49% of black children live in poverty compared to only 10% of white children. And then the final determinant of health that absolutely causes, is at the root of why we see this racial health disparities in our country, is residential segregation by zip code. It's said that what zip code you were born in is a much stronger predictor of your life expectancy than your genetic code. The zip code I live in, the life expectancy is 80 years old. The zip code I work in, the life expectancy is 70 years. There are some zip codes in cities like New Orleans where there's a 25-year gap in life expectancy from folks that were born in one zip code compared to a different zip code in a wealthier part of town. But it's not the actual zip code that causes a difference in life expectancy, but rather the residential segregation by race that is at the root of the problem. In a country as intentionally segregated as the United States, zip codes are merely a proxy for race. In Buffalo, 85% of all black folks live east of Main Street. In 2016, 24/7 Wall Street identified Buffalo as the 7th most segregated city in the USA. Black folks were historically restricted to neighborhoods separated from white folks by railroads, highways, rivers, or other geographic barriers. These stark boundaries between black and white communities have played a major role in walling us off from each other. Pittsburgh is divided by railroad tracks. Tampa is divided by Route 275. St. Louis is divided by the Del Mar Divide, which is a 4-lane boulevard. Washington, D.C. is divided by a river and a park. In Detroit, it's the 8-mile road. So why did this happen? Why are we living apart? And why does that matter? Just real quick, because of, between 1950 and 1915 and 1970, there was this great migration of black folks from the south to the north. And they didn't come because they wanted to. They come because they were fleeing awful effect of the Jim Crow South. These laws that ruled, that separated black folks and white folks based on what fountain they could drink in, what toilet they could use, where their kids could go to school, where they could get a job, what hospital or clinic they could go to when they were sick, where they could be buried. And as these people came to the north, they didn't face those rules, but the north did not welcome them. In places like Buffalo, black folks' only option in general was to go to the east side of Buffalo. Chicago, it was the south side. If you dared to go somewhere else, even if you had money, your life was at risk. And, part of this was rules that were made at that time, restrictive covenants that allowed white property owners to say that their property could only be sold to white families. Redlining, this was done by the U.S. government to look at neighborhoods across our country and decide if they were A category, B, C, or D. A category banks, they were like great candidates for loans, and money and resources flowed freely. And D category, like banks would stay away. And banks all over this country enforced this. And every black community across this country, even if the black community was thriving, were a D category. Residential segregation confined poor black families to live in neighborhoods that had all these issues. And then the final thing was, like, if you take it in Buffalo, between 1950 and 1990, actually between 1970 and 1990, 50% of the white community in Buffalo fled to the suburbs. And this white flight, they took their property taxes, they took so much of their wealth, and they left communities that were devastated. And this is very bad for the health of people that live in these places. So I've said a lot, and I want to finish up by talking about what can we do. I think first we have to be honest about where we're at and about why these disparities exist. And we have to recognize that us just being Jericho Road or being whatever you guys are, if we don't address these underlying issues, if we keep doing the same thing we always do, we'll get the same result. I do believe, though, that if we as individuals, if we as organizations, if we as a nation made the changes that we need to make, that within a generation or two, racial health disparities would no longer exist. I see this sometimes in our data at Jericho Road. We don't have a difference between black and white with regards to low birth weights, for instance, in our UDS data. So I want to talk just briefly as I close about two people. And the first is Nehemiah. And Nehemiah, just getting back to that story, so he went to the king and he said, I need to go back to my people. And I don't just need to go back on my own. I need you to share your wealth with me. And so the king, amazingly, gave Nehemiah all this stuff, wood, everything that he needed to rebuild the wall. And Nehemiah went back to Jerusalem. And he spent the next 12 years of his life rebuilding the wall, addressing the root causes of injustice in Jerusalem, and bringing the people back to their spiritual roots. And one of the most powerful chapters in the Bible, in that story, is as he talks about how they rebuilt the wall. The whole chapter, verse after verse after verse, says Josiah, the family of Josiah, built the east wall, east gate. And this family built the west gate, and on and on and on. And I decided that what I think as a symbol for what I think has to happen is that I wanted to share with you what our family at Jericho Road believes and is trying to do to overcome these racial health disparities. And I want you guys to think about the family that is CCHF. We're all across the country. What would happen, the power, if each of us in our communities rose up to this task to do justice, to advocate for justice at every level, in every audience that we can do so. And so I'm just going to give my family a chance to witness to you, and then I want to close and tell you about John Perkins.
Hello. My name is Meg Kelly. I'm a general dentist at Jericho Road. Micah 6:8. What does the Lord require of you? To act justly and to love mercy and to walk humbly with your God.
Magdalena Nichols, Chief Operating Officer. At Jericho Road, we build health centers in the most marginalized communities because we believe that this is what it means to follow Jesus.
Kayla Gleason, Chief of Organizational Strategy. At Jericho Road, we advocate for our nation to create an educational system that provides every child with an equal opportunity to learn and succeed.
Jessica Mariglia, Payroll and Benefits Specialist. At Jericho Road, we resolve to hire a diverse team that looks like the community that we serve.
Priscilla Gann, Director of Nursing. As a follower of Jesus, I believe that racial health disparities grieve the heart of God, and so I am going to commit to do unto others as I would want others to do unto me.
Christy Hartman, Medical Assistant. At Jericho Road, we believe that Black Lives Matter.
Takesha Leonard, Medical Director at Jericho Road. At Jericho Road, we advocate for our own nation to invest in a medical education system in order to deliver a medical workforce that truly reflects the diversity of our nation.
My name is Stephanie Rivera, a pre-authorization specialist. We're all created in the image of God, so there is no place for racism or inequity in the kingdom of God.
Tiffany Franklin, LPN. At Jericho Road, we advocate for our nation to end the mass incarceration of young Black men.
My name is Nicholas Dekesa. I'm working MA. At Jericho Road, we hire medical providers who are excellent, and we are committed long-term to the community.
Hello, Lorene Walker, Assistant Director of Operations. At Jericho Road, we link every patient to their own medical provider.
Hello, Paul Villante, Director of Global Health Programs. I commit to building long-term friend relationships with people who are different than me.
Heather Kim, Family Nurse Practitioner. At Jericho Road, we advocate for our nation to finally end racial segregation by zip code by enforcing the laws and by investing in affordable, low-income housing in every community, no matter what.
Good morning, Fred Kim, Development Manager at Jericho Road. At Jericho Road, we advocate for our nation to grow Black wealth.
Yinka Edwards, Medical Site Director. As a follower of Jesus, I believe that racial health disparities grieve the heart of God, and so I am going to commit to love my neighbor.
Joyce Glick, co-founder of Jericho Road. The Spirit of the Lord is upon me because he has anointed me to bring good news to the poor. He has sent me to proclaim release to the captives and recovery of sight to the blind, to let the oppressed go free.
Tony Johannes, I'm the Director of the Eastside Program Operations. At Jericho Road, we advocate for our nation to figure out a way to provide access to quality health care to every person.
Fidel Menavanza, Chief Compliance Officer. At Jericho Road, we try to follow the data. We regularly measure racial health disparities and address inequity in real time.
Hamo, Staff Nurse. At the Jericho Road, we invest in innovative medical and community programs that address social determinant of health.
At Jericho Road, we hire and train doulas from our community to partner with our pregnant patients.
I'm Brittany Barber. I'm the Clinical Education and Residency Coordinator. I choose to vote for leaders who advocate for policies and laws that will help end racial health disparities.
Hi, I'm Brent McAllister, one of the board members at Jericho Road. And I love that man. I love his heart. And I love each of you. And it is my prayer that we will challenge the church to take seriously the call of Jesus to bring the good news to the poor, to give sight to the blind, and to fight the oppression.
Thank you. So I'm going to stand with my family, and I'm going to tell you, I'm going to close this meeting by talking about John Perkins. As some of you know, John is one of the founders of this movement of CCHF. And he's come to many of the conferences and spoken powerfully, and his message and his life has resonated with many of us over the years. And he's 92 now, and he can't be with us today. John was born in 1930 in rural Mississippi, at a time that must have been hellish for him and his family. There's no worse place to be born as a black person, black man especially, at that time in that place. And when he was 17, his older brother, who had served in the military for the U.S. in World War II, came back to Mississippi and was brutally murdered by the police there. And John's family was afraid that he would be next. And I mean, this is what people faced, right? I mean, Brian Stevenson and his amazing work to document all the lynchings that have happened across the South. And all the whatever happened that made 6 million people flee as refugees in the same way that some of these folks came to the United States as refugees. And John became a refugee himself, and he fled from Mississippi to Southern California in 1947. And he lived a pretty good life in Southern California. I'm sure he faced racism there too, but it was better. And he got married, he had a family, and became a minister. But in 1960, he did something which was very radical, I think, for him and for his generation. He decided to move his family back to rural Mississippi. And he started an organization there called Voice of Calvary Bible School. And he started preaching. I mean, John is like the most evangelical person among any of us. But John realized, and here's the key, he realized that to be a true follower of Jesus, to really capture what it meant to follow God, that you cannot just speak about bringing someone close to Jesus if you don't address the oppression and the injustice that exists in our communities. And he determined, like this guy was a pastor, and he in that time period, he fought for school integration, and so his son Spencer was the first black person to be in the local high school. And John organized an economic boycott of all the white owners in that town that were refusing to serve black folks. And John organized protests and marches. And for doing all that, he was beaten, he was tortured, he was jailed. And yet he kept on doing it. And then he realized, he could see that black folks were not getting the health care that they needed. And so he started a health center. And that health center attracted some white medical students to come south and to come to the Voice of Calvary. And John and some of those white medical students eventually helped to get CCHF, CCDA started. The reality is that John took the call of Jesus more seriously than most of us do. And he decided that it's the whole thing that counts. that we have to have a personal relationship with Jesus that changes our life and transforms us, but we cannot be silent to the injustice that exists in our world and the reasons why there is the inequity. Otherwise, we miss the whole point of why Jesus came. We miss the point of what the kingdom of God is supposed to be like in the future. And so and the other thing about John as I close, and I've watched his photo as I was spoken all this morning, is that it always amazed me that a man who had suffered so much at the hands of white folks would be willing to forgive and be a part and be a friend to me, to be a friend to all of us. And so I believe that as I close our time together, that my challenge to you is to love your neighbor and to follow Jesus, and for us together to make a difference in our communities so that generations from now, my daughter, my children aren't standing in front of you with the same stuff that we're dealing with. It's time to change. Thank you very much. Mm-hmm.